Well, thank you for inviting me to come and do a presentation on Medicare 101. This is a program that we put together to help assist individuals who are turning 65 that might be contemplating going into the Medicare world, or people that are just needing additional information, deciding whether they're going to retire, are they helping a loved one. So this is kind of a basic overview. It has a lot of information, so please don't get concerned that there's a lot going on in some of these slides. We're going to go over them, and at the end, I'd like to leave time for any questions. And some of the slides I will be going through quickly, only because they may not necessarily be something that is needed at this time. But again, I just want to say thank you for including me. And here is my contact information. So if anybody has any questions afterwards, sometimes insurance can be a very individual thing, and you may not want to ask a question during this activity. But here's my information that you can reach out to me at my office, and I also oversee 4 other offices for the Office for Aging. So my cell phone number, certainly, don't hesitate to use that as well. So our Chautauqua County Office for Aging Services, we have several locations. In Jamestown, we just moved into the Chautauqua Center, and it's a little bit of a disaster right now because we're still under construction. But that will be our permanent location for a lot of our departments. We have an office up in Mayville, one in Dunkirk, and we also have a partnership with Community Connections of Findlay Lake. So I'm out there as well. So we are all over the county, and we offer a lot of services. HICAP, which is the health insurance program that I oversee, is one of our big programs, and we do a lot, especially this time of the year. We're gearing up for open enrollment. And that is the time of the year that everybody that is on Medicare reviews their plans for the following year, because Medicare plans change year after year. So we're going to go over a little bit of that, just to give you an idea of how things are broken down in the Medicare world. So we always like to have something funny at the beginning to kind of ease the anxiety, because when people come into my office for health insurance, most often they are very frustrated, and this is just an example of how people can get, anxiety-ridden. Medicare is a very, very difficult topic, and it changes year after year, so that's what we're here for. Our counselors are trained and certified by Medicare and also the state of New York to be able to provide unbiased Medicare assistance. So when people come in, they don't necessarily have to know everything about Medicare. It's almost impossible, but that's where we can step in and help and answer questions, help alleviate some of that anxiety. So, okay, so for most people, this is what your Medicare card looks like. So when you turn 65 and you are already drawing down Social Security, you will automatically be enrolled in Medicare. If you are not drawing down Social Security at the time you turn 65, you then must contact Social Security yourself and enroll in Medicare if you choose to do that. So a lot of people get confused, especially people that are working. They are not sure, should I enroll in Medicare or should I not enroll in Medicare? Because if I'm going to continue to work, maybe I don't need everything. So Medicare does have 2 separate enrollments, and like I said, it depends on whether you are drawing down Social Security or you're not drawing down Social Security. So here's just a little chart to kind of give you an idea of how Medicare enrollment works when you are turning 65. So this example shows how someone is turning 65 in July. What we always tell clients is if you are turning 65 in your birth month, you should always look 2 months at least prior to your birth month. Start looking at what you want to do with Medicare. So if you can see down here toward the bottom, this person enrolling in Medicare, if they enroll in Medicare the month that they are born, you can see down there that their Medicare is a month delayed. So that's why we always talk about these 3 months before your birth month. That's when you should be enrolling in Medicare, so you don't have any delay. If you have a total of 7 months that you can enroll, but as you can see toward the bottom, you have delays after your birth month. So we don't even recommend. I mean, there's very certain circumstances that you would enroll late, but we always tell our clients, it's best to start looking at Medicare 2 to 3 months prior to your birth month, so you don't have any delay in getting your coverage. Okay, so this is one of these little charts that it looks like, oh my gosh, this is a little overwhelming. This is something that we just want to show you, especially for you folks that are working and are considering continuing to work. You have options when it comes to enrolling in Medicare that you don't necessarily have to enroll in Medicare Part B. And Medicare has 2 parts to it. Part A, which is the hospital coverage, and Part B, which is the medical coverage. Part A, for most people that have worked, like you folks, it doesn't have any kind of a premium, monthly premium to it. Medicare Part B, the medical part, does have a monthly premium. This year it's $148.50 per month, and it does fluctuate every year. So when you are working, the biggest decision that you need to make when you become eligible for Medicare is, number 1, am I going to continue to work? So you can see here, it says, do you have insurance through your employer? So if you do have insurance through your employer, it does depend on how big your employer is. Now, the Resource Center is a large employer. So for you folks, you would be able to disenroll with Medicare Part B if you continued to work. And this is the key thing, is that you do not have to enroll in Medicare Part B if you are actively continuing to work when you turn 65. If you retire, all bets are off. You need A and B. But if you continue to actively work and you want to keep your employer coverage, you do not have to enroll in Medicare Part B at that time. You will not get a penalty, and when you do retire, you have a special enrollment that will allow you to now jump back into Medicare Part B. So you can see here that if you want to continue to work, you can delay. At the very bottom it says delay signing up for Medicare coverage until you leave your job. So that's if you decide that you're going to continue to work for the Resource Center and just enroll in Medicare Part A. We usually recommend that you continue to enroll in Medicare Part A because it doesn't cost anything. And you can have that along with your employer coverage. But if you enroll in Medicare A and B and you take your employer coverage, it's kind of a duplication of services, and you're paying Medicare for something that you're really not going to get that benefit for. So again, actively working, you can drop Medicare Part B. Okay, so let's talk a little bit more about delaying Medicare Part B and what you need to be aware of. We kind of spoke a little bit about that. So again, retiree insurance. If you retire, so you're not actively working, you must have Medicare Part A and B, or you can be penalized. If you are self-employed, you must have Medicare Part B, because a self-employed person has a small amount of people working for them. So even if you're 65 and you're in this group plan, if it covers at least one other employee, or purchased through an association. So for instance, if you have a small business and you are part of the chamber, that's considered a large employer like what you are at the Resource Center, so you can drop Part B. But most self-employed businesses are small. They have 20 or less people. That requires that you have Medicare A and B when you turn 65. Domestic partner is the same thing. It does not count for people eligible due to age 65. So if you are a domestic partner, your partner has coverage. When you turn 65, you need your own coverage, and that's Medicare A and B. And veterans, this is where a lot of our veterans get into trouble. So if you know a veteran or you're caring for a veteran and they are turning 65 and they have VA coverage, a lot of them think, well, I have veterans coverage. I don't need Medicare Part B. Why would I pay for something like that when I have the VA? Well, we always recommend enrolling in Medicare A and B because the VA is not considered credible coverage, believe it or not. And if at some point an individual who is a veteran decides they want to use the private sector, so say they can't go to Buffalo or Erie for their medical services through the VA, and now they need to go see Dr. Lamancuso or Dr. Vigendala. If they don't have Medicare Part B and they want to go to a private doctor, they either can't do that or now they have a penalty because they didn't enroll in Medicare Part B when they turned 65. So for veterans, even if they don't think they're going to use Medicare Part B, right away, they should enroll in it so they avoid a penalty. A lot of people get confused about COBRA. They think that, well, I have COBRA, so I don't need Medicare Part B. That is not true. COBRA is again not considered credible coverage, and if you choose to be in COBRA and don't enroll in Medicare A and B when you are eligible, you could get penalized somewhere down the road as well. Federal employees, they have a special situation where they can opt out to Medicare Part B without a penalty, but we still recommend that they consider enrolling in Medicare Part B too, just because the FEHB health benefits sometimes are not sufficient. So again, that's an area that if you know someone that's a federal employee and they want to just make sure that they're doing the right thing, like postal workers and things like that, tell them to give us a call. People living outside of the USA, again, but they cannot delay. So if someone is living outside the United States or is incarcerated and they turn 65, they don't get any special enrollment. They still have to enroll in Medicare Part B when they become eligible at 65. Let's see, and the health insurance exchange, again, if someone has been on Medicaid and they're turning 65, they still need to enroll in Medicare A and B. And a lot of things change at that point too, because people get reevaluated for Medicare and Medicaid at that point. Some people will continue to keep Medicaid, but others may not. So that's another area that if you have questions about, it can get really complicated, and we're here to help. So again, these are just quick cheat sheet of what Medicare is made up of. So you hear about the ABCDs of Medicare. This is it. Medicare Part A is our hospital coverage. Medicare Part B is doctor. Medicare Part C is also called a Medicare Advantage. So you folks might hear about Medicare Advantage plans, and then you hear about Medicare Part C. It's the same thing. It's just the terminology. They like to really confuse us by giving things all kinds of different names. So Part C is the same as a Medicare Advantage plan. And then, of course, you have Medicare Part D, D for drugs. And the last thing, it's not necessarily a Medicare, but you might hear about this frequently, is called a Medigap or a supplement plan. And a lot of folks have that ARP plan out in the area. That's considered a Medigap plan that goes with Medicare, so we'll talk about that. Okay, so Medicare Part A, like I said, it covers your hospital stay. And for most people that work, there's no cost to it when you're eligible for Medicare. So there's no monthly premium for the most part, but it does have a deductible. So for instance, if you go into the hospital and you just have that red, white, and blue card, you don't have any other insurance, and you go to the hospital even for 1 day and you are admitted, there's a deductible this year. It's $1,484. That changes every single year, and believe me, it doesn't go down, it goes up. So that is something for people to be aware of, is especially with hospital, just having Medicare by itself could be kind of expensive. And this deductible hits you every hospitalization after a 60-day period. So if you have multiple hospitalizations, you might get that deductible every time you go if it's beyond 60 days. So that's something just to kind of keep in mind, that A lot of people just think, well, Medicare by itself, that's enough for me. Not so much anymore. Okay, so let's look at Medicare Part B. Okay, so Medicare Part B is, again, the medical portion, and it has a premium of $148.50 in 2021, and that goes up every year. So sometime in November they will announce that, and you'll pay a different amount if you have different programs that might be available. So if people are on the Medicare Savings Program, which is a great program, it's not insurance, it could pay that monthly premium of the $148.50, and it's income based. This is something that when we do counseling, we always ask about people's income to see if they would qualify for this type of special program. And that's a really big deal, because if you have a couple in a household and they're eligible, that's, you know, $300 a month that they're going to get back in their pocket each month. And then also the other benefit, well, not necessarily a benefit, but if you have a higher income, you could actually pay more than the $148.50. So if you're low income, you can get that paid for. If you're higher income, you might actually have to pay a little bit more in that premium amount. So some of the changes that happen each year, and this is still for 2021, we haven't gotten the new ones for 2022 yet, but the Medicare Part B annual deductible, and this is for medical, is $203. And what that means is if you just have your Medicare plan and you don't have any additional insurance, and you go to the doctor or the hospital, you have to pay out of pocket $203 before Medicare kicks in with the co-pays. And Medicare Part B pays 80% of the cost. So the 20% that it doesn't cover is something that gets billed to you if you don't have additional insurance. Again, Medicare Part B does have a late enrollment penalty that we spoke about. It's 10% of the monthly premium for the current year. So if you let your Part B go, and this is again where the veterans get caught, is, you know, they may decide they need Medicare Part B 5 years down the road. That's 5 years of a premium amount that they get assessed. And we've seen some veterans that are in, you know, maybe their early 80s that no longer can travel to Buffalo or Erie, and they want to go locally to a doctor. And we're seeing penalties that upwards of $200 and some additional dollars a month. So this is a serious thing, especially for our veterans, because they don't really get told by the VA administration. Our local guys that are in VA services are awesome. We work with them, so they know to counsel their veterans when they turn 65. But the higher up VA administration still doesn't really tell the veterans that they should consider enrolling in Medicare Part B. So again, if you have family members or friends and they're veterans, this is something that you should definitely be bringing up to them. Okay, Medicare Part D is all about prescriptions, so D for drugs. And you can get Medicare Part D in two ways. You can get it through a standalone prescription drug plan. Some of the examples in our area are SilverScript, Cigna, United Healthcare, Blue Cross Blue Shield have some just standalone prescriptions. There's 26 different prescription plans just in Chautauqua County alone, and every single one is different. So this is where things start to get really confusing when you're trying to figure it out all by yourself. Wow. So each prescription drug plan has a deductible, and the deductible is something that you have to pay usually at the beginning of the year or the first time you go to get your prescriptions. This year it's $445 for most plans, and it is based on higher tier drugs. So for instance, if you take an inhaler or some insulins or some other treatment, the deductible would apply to those. Generic drugs like blood pressure medicines and statins for cholesterol, things like that, most of those are generic, and this deductible does not apply. But this hits everybody usually at the beginning of the year because the deductibles, they kind of rejuvenate at the beginning of the year. So January and February, when people go to get their drugs from the drugstore, a lot of them get hit with a $300 bill for one of their drugs that they weren't counting on, and they get upset because they don't understand their drug is being put against their deductible. And until they meet that deductible, then the drug goes down. So the beginning of the year, for a lot of people, we're seeing high costs for drugs because the deductibles. And that deductible goes up every single year. So again, we don't know what the deductible will be for next year, but I can guarantee it's not going down. Premiums for this year, a lot of the drug costs, the premiums have remained really stable, so that is good news. And we're thinking that for next year, we're hearing little whispers that the premiums are going to stay pretty across the board. So hopefully we'll see some good things with the drug plans this year. And once we do, I'll be sharing that in the newspaper and putting things on Facebook, and also just letting clients know as we learn this information. Changes in formularies. So when you are looking at your prescription drug plans, whether it's in a standalone drug plan or maybe in an Advantage plan, the formularies are the list of drugs that the plan actually covers. So not all drug plans cover the same drugs or cover them at the same level. So again, it's very, very, very individualized and based on your medications that you take. So here's just a point of caution that when it comes to talking with individuals that are brokers, agents, and again, they're wonderful people. I'm not saying they're not, and I'm not saying that you shouldn't reach out to them. However, when you talk to someone who is an insurance salesman, make sure that you are asking them to run your medications through the plans that they are showing you, because we have found that a lot of times the insurance companies are not necessarily looking at your drugs. They're just showing you, oh, well, your doctor's going to cost this, and you can go to this doctor in this hospital. But they're not putting every single one of your drugs in the system to see if it covers. And we have a lot of our seniors especially that will come to us after open enrollment in January and say, my drugs aren't covered, or they're too expensive. And that's usually because no one's taken the time to put every single one of their drugs into the system to review the plans. So again, these plans are all different. Some of them require pre-authorization for specialized drugs. So, you might be taking a certain insulin, and this drug plan does not cover it, and you have to get a special authorization, and that's working with your doctor. So these types of things, with prescriptions especially, there's a lot of details. You can see pre-authorization, step therapy. What step therapy means is if you, for instance, for women, Synthroid is a big deal. Synthroid is a thyroid medication, and Synthroid is the brand. It's the higher tier. And they also have a generic called levothyroxine. Most doctors will prescribe levothyroxine, but for a lot of women, it does not work for them. So they have to go back to the brand name Synthroid. Well, a lot of the prescription drug plans are saying, no, if there's a generic, we're not going to cover the brand. This is where you have to prove that you have tried the levothyroxine and now, and it doesn't work, so now you have to go back up. That's called step therapy. And again, that's with your doctor. They have to write a letter to your prescription plan to tell them you have to take this medicine. And then the prescription plan can decide whether or not they're going to cover it. So they have a lot of power.
That sounds like a nice
Part D prescription coverage also has a penalty that if you don't enroll when you turn 65 into a prescription drug plan, even if you don't take any medications, you should still enroll in a prescription drug plan to avoid a penalty somewhere down the road when you may need that prescription drug plan. It doesn't sound fair, and it's a little frustrating for us in that, it's almost, they don't say that it's mandated, But if you need a drug plan later on and you don't enroll when you're turning 65, you're subject to a penalty. So in my mind, that's mandated. If you're in a higher income bracket, your prescription drug plan premium may have a higher cost as well. Okay, I'm going to skip over this because that is a little bit too much for right now. Okay, and we did talk about the penalties, Part D penalty as well. Now, this is a chart that we use at the office for aging. And basically, when you are turning 65, so for you folks that are working now and you're turning 65 and you're trying to figure out, should I continue to work? If I do continue to work, should I keep the employer coverage, or is Medicare better? Because just because you continue to work doesn't necessarily mean you have to take the employer coverage if Medicare looks like it might be better for you. We do this a lot, especially with the manufacturing companies. There's a lot of plans that are available to workers, but they have to pay quite a bit. So Medicare is always an option, and if you're going to continue to work, you want to definitely look at your employer coverage, but don't just disregard Medicare. So when you are looking at Medicare, Medicare has two different types of options. One is you take your traditional Medicare, that's that red, white, blue card, and you need to add a prescription plan to it because Medicare by itself, that red, white, blue card only covers hospital and medical, and the medical is only covered at 80%. So there's a whole lot of gaps going on. You don't have prescription coverage, you don't have dental, vision, and hearing. So what can you do? So option one here is that you would add a prescription drug plan to it, and then a lot of people, to cover that 20% gap that Medicare doesn't cover, they will enroll in a Medigap Plan. And remember, I talked about the ARP plan. I use ARP only because it's very popular, but there are a lot of companies that offer this type of plan as well. So what happens is Medicare pays first, and they pay the 80% of the cost of your medical, and then your supplement or that Medigap plan picks up that other 20%. Now that sounds great. We call that peace of mind. We call that the Cadillac plan because there's no networks. You can go anywhere across the United States. Medicare is first, and the supplement pays second. The biggest thing that people need to realize is that these plans, these supplement plans, have a significant monthly premium. So you have the $148.50 from Medicare Part B that you're paying. You have a Part D plan that could cost upwards of $30. And then you have the Medicare premium amount for the supplement or Medigap plan, which is usually $185. So you're looking roughly at $350 a month for basically 100% coverage and no networks. So it's a good plan if you have some serious medical issues, or you travel a lot, or you just want that peace of mind. Now, a lot of people go, oh, I can't afford that, and I don't go to the doctor that frequently. What else? So the second option is what's called a Medicare Advantage plan, and remember, it's also called Medicare Part C. So what that is, those are private companies that Medicare contracts, and they provide Medicare A and B coverage. But the advantage is they also include a prescription drug plan and possibly some dental, vision, and hearing, very minimal, but some, all rolled up into one plan. So the companies in our area that are most popular are Univera, United Healthcare has a PPO plan, Blue Cross and Blue Shield, Independent Health, all of these companies, Humana is another one. These are private companies that $148.50 that you have to pay for Medicare Part B now goes to them to cover the cost. And what the bonus is that these plans usually don't have any additional cost, or if they do, it's a very minimal amount. So these plans are extremely affordable, especially for people that are turning 65 that don't necessarily have a lot of health issues. Maybe they need their drugs covered and maybe a doctor visit once or twice a year. These are good, I call them starter plans, and they're pay as you go. So that means that you don't pay anything or very minimal a month. You pay when you use the service. So if you go to a doctor's office, you might pay $20, $15. If you have an outpatient procedure, you might pay anywhere from $325 to $450. Once you start to see your health issues change, this is where participating in open enrollment, because now you can review these plans every single year and make changes. So you're not ever stuck in anything, and your health is going to change as you get older. So of course your health insurance needs to change as well. So these are the two options that when you decide to go into Medicare, you got to figure out, do I want the premium one that is more expensive, but it covers everything, and you know, budget wise each month I'm going to pay this much, and if I have a catastrophic issue, no worries. The other option is the Advantage plan, where again, you pay now or you pay later kind of thing, and if you don't have a lot of health issues, this is a good type of plan to consider. Okay, so we're going to go through this really quickly because I don't know how many of you are actually on Medicare, but just here's some tips on how to use it. So again, what kind of coverage do you have? We just talked about the two different options, the Medicare Advantage, pay as you go, or the supplement or Medigap plan that has full coverage, but it's more costly. Medicare Advantage plans, the low monthly premium, they have co-pays with every service. They do have networks, so Medicare Advantage plans, you have to use doctors and hospitals that are in the network of these plans. Sometimes that can be a little tricky, but in Chautauqua County, most of the plans the doctors take, so we're very fortunate. When you start to go into Erie, that's where you really need to, if you're going to enroll in an Advantage plan, you want to make sure that your Erie or any Pennsylvania doctors are in network, because if they're not in network, you could get denied services. So Advantage plans take a little bit more work when it comes to making sure that your doctors are in network. They do have the additional services like prescription, dental, vision, hearing, and something new over the past couple of years, and we're hoping to see a little bit more of that next year, is that they're also going to start offering medical transportation. They've been offering fitness programs, so if you belong to a gym, you can get a benefit there that they'll cover the cost of your gym membership. So a lot of people take advantage of that. There's a lot of bells and whistles with the Advantage plans. Okay, so we already talked about how they work as far as a Medicare Advantage plan takes over your Medicare, and it's a private company that covers that. So you carry one card. You don't need to carry your Medicare card, but don't throw it away. But they do have HMOs, and an HMO means that you can only use doctors that are in that network. And labs, blood labs, that's a big thing this year. If you enroll in a Medicare Advantage plan, you want to make sure that the labs that you are using for blood draws are in network, because just because the hospital might be in network, the labs might not. So like I said, it does take a little homework. They also have, they come in a PPO, which means that you have a little bit more flexibility with networks. And most Advantage plans, if you want to see a specialist, you do have to get a referral from your PCP. Some people don't like that. And you may need prior authorization for tests and services. So again, Advantage plans are great, but they do take a little bit more work. Let me skip over that. Okay. Now, why would you enroll in a Medicare Advantage plan? Again, they're pay as you go. They're affordable. They are great for people that don't have a whole lot of health issues and just want prescription drug coverage. And you only have to carry one card. I've had lots of clients come into my office and they pull out their wallet and they have a million cards because they haven't thrown them away and they don't know what they have. So with an Advantage plan, you just carry that one card. Medigap plans, again, they're called supplements. These go together with Medicare, the original, and they supplement. Remember, they pay the other portion. There's different levels of those plans, but for the most part, again, they're peace of mind. They don't have networks. Anybody that takes Medicare, you can walk in the door and you don't have to have pre-authorization. They're a no-worry type of plan, but they do have a larger monthly premium. So they give you that peace of mind, no networks. They cover all medical treatments. One thing to note for this type of plan, if someone has cancer or any chronic illness, even rheumatoid arthritis, something where they have to have blood infusions or they have to have dialysis, we highly recommend they look into a Medigap supplement plan, because the co-pays that they would pay with an Advantage plan for these type, like dialysis or rheumatoid arthritis, you get an infusion, they're astronomical. So these types of plans come into play when people start to see that their illnesses become, you know, a little bit more chronic, a little bit more costly. And again, you have the option to make changes, not only during open enrollment. There are other things that we can do at the Office for Aging to help you change your insurance if you find that, God forbid, you get diagnosed with cancer. Pick up the phone and call us. Okay, so I like to do this travel tip kind of thing. So just, these are little things to keep in mind, that whatever type of plan you have, always make sure that your doctors have the most updated information. So again, at the beginning of the year, every single year, no matter what insurance you have, make sure that your doctor has that updated information, because we've seen lots of times where the doctor's office doesn't have the new updated information and they bill the wrong insurance, and it becomes a nightmare. So always at the beginning of the year, and most doctor's offices will ask at the beginning of the year or the first time you go for your updated insurance information, but that's just a little reminder. Preventative services are something that Medicare also offers, and that is something that there's a list of all kinds of different things, flu shots and whatnot. Always talk to your doctor and find out, are there preventative services that I should be taking advantage of? They don't cost anything. So talk to the doctor when you go in for your annual checkup. Learn how your plan covers hospital stays. That's a big thing. So if you hear, anytime you hear the word observation status, start questioning and asking, is this a necessary function? It is something that could cost you more if you have to go into the hospital. So, and then don't be caught off guard. If your plan has a deductible, does it cover all your drugs? Is your doctor in the network? These are just, again, basic questions that when you are starting to look at Medicare coverage, these are the questions that you should be asking whoever you go to counsel you. There are a lot of programs that help with costs. These are just a few of them. And again, during any kind of healthcare session, we would go over all of this. But just know that if you run into a situation where you're in a Medicare plan and you start to see costs that you can't afford, there are all kinds of programs that are available to individuals that can help lower the costs. And these are just a few of them. And so that is the end of my presentation. If anybody has any questions, I know I hit you with a lot. That's one of the reasons I wanted you to have the actual handout, so that you have that information to refer back to. So thank you again for having me do the presentation. Does anybody have any questions about anything or specific concerns?
That was excellent.
That really was great, Christine. My goodness, that's fantastic information.
It's a lot, and
it's a lot of information.
I just want to reassure people that you don't need to know all of this. It is absolutely a very, very difficult, fortunately, process. But there are lots of people out there, including the Office for Aging and many others, that can help kind of navigate through this and help you understand what the next steps might be before you make that leap. So don't feel like you have to figure it out yourself.
Lori asked the question, where are the handouts? I emailed them to everyone prior to this presentation. So just go into your email and you'll find that.
When does open enrollment start and when does it end?
Open enrollment for Medicare starts October 15th and it ends December 7th. I know that there's a lot of confusion because the marketplace open enrollment is kind of a little bit different, but October 15th through December 7th is and you're going to see, if you're getting close to 65, you guys are going to get inundated with all kinds of mail from all kinds of insurance companies wanting you to enroll in their program. So if you're interested in having anybody help you, I would, suggest that you call the Office for Aging. We are working with a few vetted agents because we have so many people that are needing our services. We just don't have enough staff. So we actually were able to I trained them specifically to be able to counsel as well. So if for some reason you're not able to get into the Office for Aging for an appointment, there are several highly qualified, these guys are great, that can also provide the same unbiased service that we do at no cost.
Perfect.
Okay.
Anyone else have any questions, comments, concerns? Well, Christine, this has been really helpful. We appreciate you taking the time to give us all this wonderful information. So thank you so much.
Well, thank you for including me, and if there's any other programs or things that you might be interested in that the Office for Aging offers, home care, we have all kinds of different programs for caregivers. Please don't hesitate to reach out to us. We'd love to be able to share the information.
Great.
So thank you.
Well,
Have a good
thank
day,
you.
everybody.
You too.
Thanks so much, Christine. Take
Bye-bye.
care.
Okay, are we off? Okay. We definitely need to.
Look.
Yep. Can you hand me that piece of paper, the flyer, so I can keep it together with the sign-in sheet?
Yeah.
And this is probably, he can cut this off though, because otherwise they'll hear me
Hold
talking.